A silent crisis. The state and experts agree addiction is a problem affecting New Mexico teens.
And they say there is no other program in New Mexico that did what the adolescent program at the Turquoise Lodge did. And new this morning, it's why local leaders and industry professionals want to know why there was no discussion or public input before it was shut down. News 13's Catherine Mazzone's been working on this story for weeks. She's live at Turquoise Lodge in southeast Albuquerque this morning. Catherine?
Good morning, Crystal, Adam. Now, the 20 beds that were formerly reserved for adolescents here at Turquoise Lodge are now open to adults. The state says that's because there's a great need for the adult beds, and the other program just wasn't being utilized. Obviously, it's left many baffled based on the statistics, and they're wondering how there wasn't a conversation, and they want one, and they want to know how to fix it.
Local leaders say addiction is killing our kids.
We have one of the highest overdose death rates in the nation.
According to industry professionals, substance abuse can also end up costing taxpayers big bucks for emergency services, corrections, and court.
If we're not dealing with it on the front end, we're going to deal with it on the back end.
The state says it took notice.
It just seemed like the right thing to do at the time.
Creating a 30-day inpatient treatment program for adolescents at the existing Turquoise Lodge.
And it was a really exciting time. I think there was a lot of optimism, there was a lot of hope.
Now, less than 3 years later, the need is still there, but the teens are gone.
Our intention isn't to say, hey, there's not a need for these services. What we're saying is there wasn't a need for these services at our facility.
Department of Health Representative Kenny Vigil says the program wasn't worth the cost.
This is taxpayer money, and so how do we justify to the taxpayers that there's this 20-unit facility for teens and that on average there were 15 empty beds?
Vigil says oftentimes potential patients didn't have the primary diagnosis of substance abuse as required. He also claims data revealed many teens didn't want to be away from friends and family for a full 30 days. But for Holland and many others, the state's reasoning raises more questions.
What's an acceptable loss in regards to serving young people?
If we had filled even 17 beds, I don't think we'd be sitting here having this conversation.
Yet, if the state knew the program was in trouble, why not alert industry professionals who could have helped boost attendance?
People may get upset, may say, you can't do this. And we're really trying to make the best decision for the public based on what the demand is, and that's the decision we made.
And it sounds like you didn't want to ruffle too many feathers.
You know, I think that may not be an accurate way to put it. How many more teens, based on the history, would we have been able to serve?
Vigil says scaling back wasn't an option. That would have meant mixing teens and adults. And outreach? He says they did plenty. Still, some aren't convinced.
It seems that some discussion would have been valuable. You know, a discussion among the individuals and the organizations that had really fought so hard to get those beds open. How can it be done better? Rather than just saying.
Hart Stebbins still hopes there's an opportunity to better meet adolescents' needs when it comes to substance abuse and having that conversation. The Department of Health says it's not taking that off the table just yet, but it's not planning to do anything just right now.
All right, Catherine, thank you. We have a lot more on our website, including attendance and referral data and a list of outreach efforts this morning.